Hello and welcome everyone to the first Q&A with the experts. Today we are delighted to have with us the Head of Medical Oncology at the Northern Center for Cancer Care at the Freeman Hospital, United Kingdom, Dr. Mark Verrill. We are also pleased to have with us live Dr. Meteb Al Foheidi, who is the Associate Professor and Consultant Oncologist at National Guard Hospital, Jeddah. He's also the President of Saudi Oncology Society. Dr. Mark Verrill and Dr. Meteb Al Foheidi, thank you very much for taking your time out from your busy schedule and record this Q&A with experts. The topic of our first Q&A with expert is Monarch 2 OS interim analysis data disclosure at ESMO 2019. My question, first I will address to Dr. Mark Verrill and then to Dr. Meteb Al Foheidi, is what is your comments on the patient characteristics in the Monarch 2 study and related results in terms of overall survival data? Dr. Mark, over to you.
The Monarch 2 trial of fulvestrant with or without abemaciclib is a really important trial when planning treatment for women with endocrine-resistant metastatic breast cancer. And of the three CDK4/6 inhibitor studies, has the inclusion and exclusion criteria that match most closely onto routine clinical practice, in that it allowed women who had relapsed either on or within a year of completing adjuvant endocrine therapy, or who were progressing during their first line of endocrine therapy for metastatic disease, which is what we see most commonly when we're thinking about a CDK4/6 inhibitor. Those women were randomized to fulvestrant or fulvestrant with abemaciclib, and we saw initially a very impressive progression-free survival advantage, and more recently an overall survival advantage which is statistically significant, and an improvement in overall survival of around 9 months. And this is really important for our patients with metastatic disease because it means that we're extending their lives, and in secondary analyses we're delaying the time at which they may need to receive chemotherapy.
Thank you, Dr. Mark. Dr. Meteb, your take, please.
So Monarch 2 is a randomized double-blind placebo-controlled clinical trial which tested abemaciclib, a CDK4/6 inhibitor, in peri, and postmenopausal women with advanced breast cancer. So those patients were randomized to receive fulvestrant with or without abemaciclib. And the primary endpoint was progression-free survival, and the progression-free survival was reported 2 years ago and showed that the addition with abemaciclib resulted in statistically significant improvement in progression-free survival with an absolute benefit of 7 months, with a hazard ratio of 0.5. What is interesting that the secondary endpoint of overall survival was reported at the last ESMO meeting, and it showed that the addition of abemaciclib again resulted in statistically significant improvement and clinically meaningful improvement of absolute benefit of 9.4 months with a hazard ratio of 0.75. In regard to the patient characteristic, those patients were endocrine resistant. Most of the patients had visceral disease, approximately 55%, and most of the patients had secondary endocrine resistant of 75%. Those patients were stratified by the site of the visceral metastasis, as well as by the endocrine resistant to the prior endocrine therapy. The overall survival benefit observed with abemaciclib was consistent across all stratification factors. So patients who had visceral disease, they had a larger benefit from the addition of abemaciclib, and the same is true for patients who had primary endocrine resistant.
Thank you very much, Dr. Meteb Al Foheidi. Thank you very much, Dr. Mark Verrill. for this digital recording, and stay tuned for more Q&A with experts. Thank you so much, and goodbye for now.